You've written a book called Internet of Healthy Things, and it has become a best-selling book. Why?
Well, we hit the market at a good time, to be honest with you. The idea of the Internet of Things was just coming into people's consciousness, and we just said, you know, this is going to have an enormous impact on how we deliver care. And so being able to write that out at a time when people were hungry, I think was one. And the other is we deliberately wrote the book in a way that's very accessible, so that you don't have to be a medical professional or a technologist to understand it. And I think those two things really allowed us to get widespread readership, which was great.
So people are worried about their healthcare in the US.
Oh, sure. The US is an interesting market for all of this stuff. There's an enormous amount of innovation in digital health, but it's quite fragmented. And yes, people are worried about their health, but they're also, I think, probably more worried about their individual freedoms. So when you start giving them things, tools, strategies for accountability, they get a little bit nervous.
So what were the messages of your book?
So the Internet of Healthy Thing was really about how all of this data is now coming in from wearables, from your mobile device, from GPS tracking, and really if you look at other industries, retail in particular, they've already shown us what that future will look like. You show up at a place like J. Crew and they know what you've bought and they point you to a rack where you can get an accessory, and all that's done through Internet of Things technology. So how will that apply to health? And with all the data coming in, if we can normalize it and if we can get it to a point where it makes sense, then the next phase is we can apply deep learning, machine learning, right? There's a whole aspect of that. And then finally, create a unique profile of you. And with that unique profile, be able to message you in an inspirational way to improve your own health. And so we've seen examples of that, and that's very exciting. When I started doing this work, wearables wasn't a thing, IoT wasn't a thing. So to see it mature in this way is very exciting.
So can you give some concrete examples of the changing of people's opinion and attitude?
Oh, I think, you know, for attitudes, we have people now, enough people have now measured their activity that Fitbit is a public company. And I never thought they'd be a public company when they launched. And I was wrong. And so they have wonderful statistics about the population level impact of their device. That's just one example. And I think on average people walk 1,800 steps more a day when they get one. And yes, some of them wind up in the drawer, we know that, but 50% of people actually stick with it. And so that's an example, a simple example, but if 50% of people are walking 1,800 steps a day more than they were before, that's powerful.
Now you've been attending this e-health conference here in Tallinn, and you said that there's some other kind of dynamic in Europe than in the US. Can you talk about that?
Well, the conference has been a lot about data liquidity and standards, and again, that's very important. There isn't much appetite for that in the US at this point, and so we're having to figure out ways to move our vision forward without waiting for that. So I'm delighted to see it happening in Europe, and I'm really going to continue to watch carefully, because if those things can be solved, we'll really get a sense of whether the market will change for digital health. Whereas, as I say, we'll have our, if you think like a scientist, our control group in the US, because there's just not much appetite right now for interoperability and or standardization.
But can Europe learn something from the US experience?
Well, I think so. I think there are ways in which we've done some things we're quite proud of. We've been able to move forward with a widespread adoption of virtual visits with physicians. That's happening. And a number of other, as I mentioned, the sort of attention that wearables and mobile apps are getting to improve health, I think is something to watch. Groundswell, the number of companies that are being created that are selling services into health plans. United Health Group, which is the largest insurer in the US, has a program now where they, through their employer sponsors, are giving individuals a tracker for free and tracking their activity data, and then if they meet certain milestones, will get money back in their health savings account. So it's an interesting, from a number of perspectives. One is paying people for their data, and the other is paying people to be more healthy. So there's the privacy angle to that, there's the incentives angle, how long will that incentive work? So I think we'll all learn from that experiment it's just an example.
And this improves people's health.
Well, sure. Being more active is obviously a big predictor of improved health, yes.
And what about when it comes to chronic diseases and more kind of serious health issues?
So chronic diseases, we've done very well with home monitoring, particularly for congestive heart failure. I saw a movie this morning on COPD here, which is another really good indication for home monitoring. That's moving in the home care industry in the US, and some forward-thinking hospital systems are using that kind of a tool as well. So slow but sure progress there as well.
You talk about this new mobile age. What is that?
Well, that's the title of our next book that's coming out in a week, and that's about health technology and aging, and the idea that, you know, we've just added in the last century 25 years to our lifespan through things like public health initiatives and medical breakthroughs. And my grandfather was 49 when he was 62 when he died in 1949. My father died in 2008. He was 88. And you know, we're all living longer, and that's a beautiful thing. But what we haven't done as a society is really look at how we're going to capture that extra 25 years for productivity, happiness, health, adding value back. And we thought it was important to start to address that in this book, because if we, societally again, if we don't do anything, we're going to actually run out of people to take care of those that are getting older. By 2050, 16% of our population around the world will be over 65, double the amount under 5. So you can just see the trends demographically, and if all we can do for caregiving is a one-to-one relationship, we're just going to run out of people. So now is the time for us to figure out how to integrate technologies in ways that are extensions of our human relationships rather than getting in the way of them. And that's novel territory, and it's a lot of fun to see. There are a lot of startups, a lot of programs in the area trying to get that right.
So we are kind of on the verge, or already living this kind of revolution where you get these technological innovations, people's individuality, and then hospitals and different providers together.
Yes, on the provider side, what our big challenge is, again, we have to decide when can we do one-to-many care. Today, all you get is one-to-one. You come visit me in an office, you get health care. There's so many other industries that have moved beyond that, where they can deliver a service with a human being, but wrap it in a mobile wrapper that allows it to be much more efficient. And that's our challenge for care delivery. And our societal challenge is just, again, creating those tools that allow you to have a sense of purpose. The three things that predict longevity, sense of purpose, social connections, and physical activity, once again, are really important. And we can use technology to help folks harness their wisdom, their mentoring, their ability to give back using those tools.
Where are we standing in about 5 years' time? What is your vision for the near future?
Well, you see, in 5 years, and if it's in healthcare delivery, it's like a quarter in any other industry. It moves very slowly. But what we're seeing is tools like virtual reality, artificial intelligence, are becoming much more integrated into care delivery in interesting ways, and those things are going to happen over the next 5 years. We'll be more and more using things like chatbots and other tools, as I said, to extend relationships to one-to-many. Again, we have to do it thoughtfully, we have to do it the right way so that no patient feels like they're being robbed of their relationship with their physician. I'm sure we can do that, and again, we have to do it.
What do you think is the biggest challenge? People's fears or conservative attitudes towards new technology?
You know, it's a great question. On the doctor side, it's fear of work. We are deathly afraid as a profession that technology is going to take over our jobs. I think most people are at some level. On the patient side, it's what I said earlier, which is fear of losing your relationship. And that's because those of us who give the market solutions in digital health, really haven't done a very good job of giving people something that we've under-imagined how we can use technology. And if you think of companies like Uber and Lyft, we haven't done anything like that in healthcare, where you can have this enormous experience that's actually fun, but you have an experience that's delivered by a human being in a very efficient way. That's our challenge in healthcare delivery, and that's why I think a lot of people, when they think about integrating healthcare, technology into healthcare, they think about two kinds of experiences. One is that phone tree experience where you can't get a person. It's really frustrating. The other is, at least in the US now, because of our integration of electronic records, when you go to see your doctor, usually your doctor's typing and not looking at you. And that's really off-putting. So we haven't given our patients much hope that we can integrate technology well. So we have to do that better. And as physicians, when it turns out that technology will not take over our job, we just have to rethink what it's like to be a caring individual, to use emotional intelligence, to use judgment, to pay attention to quality. Those are all tools that machines can't do. But the things that we spend all of our time and energy on, like gathering data, formulating a hypothesis, technology can do that better now. So we need to just change our thinking a little bit.
So it is a matter of confidence and belief building and communicating these changes.
So, you know, as doctors, we've sort of lost our way a little bit. We became really passionate about how we could be technical experts rather than caring individuals, and we've just got to get that back.
Thank you.
It's a pleasure.
Mr. Brian Connor, you've been dealing with e-health issues for quite a long time.
Yes.
What are the main issues here at the conference that you pay attention to?
I think the key thing that people are waking up to is how beneficial e-health or the deployment and implementation of e-health solutions can have on people's lives. So forget about the technologies and so on, but really getting into how do you make our lives better?
You say people are waking up.
Yeah.
What that means?
I think for a long time now, governments especially have looked at rightly the question of how do you protect citizens against hacking, how do you give them cyber security, what laws do you need, all of that's really important. But not enough attention or action rather has been paid to, yeah, but what can I do now with existing technologies which really would help my citizens? And that's where I see there's a fervor, there's an excitement about, you don't need to invent many more things. There are lots of things we all use every day, like phones and iPads. Why aren't we using those right now? And I think that's what I mean by people are realizing we can do a lot already without waiting any longer.
We in Estonia already enjoy many benefits of this new e-health system, but there is still a lot of skepticism in some parts of Europe. So what are people skeptical? I think confidentiality is one issue. People still think that paper is safer than the cyberspace.
Yes, I think all of those are true. However, they're also used as an excuse sometimes by those who should be promoting things. When you pick up your phone and you do your banking or you do your travel booking or you do your internet or whatever it is, you do it. I don't necessarily know how my phone works, nor do I care. I just want to know it works. I'm assuming someone somewhere has built-in safeguards to protect me. What I'm saying is let's do what we can do, what's possible. I think there's too much concern over cybersecurity. I don't mean it's not important, but in the end we all know that we are all happy to get a good service, but to do that you've got to share some information on yourself. So there's a degree of risk the citizen can decide upon.
We see a lot of goodwill here at the conference that those services should be implemented and the process should be rather fast. But it's not fast at all. Our former president of Estonia, reminded us yesterday that it took 5 years to implement the e-prescriptions between Estonia and Finland, although 5 years ago the technology was already there. But to overcome the legal hurdles, it took time. And his main call was that let's speed it all up.
Well, I met with your former president in Boston almost 5 years ago when he was launching this task force, and he said the same thing then. He said, this will be done in a few months.
So that was the EU task force?
That's right, he was the e-health task force leader. He did a brilliant job though, in the sense that, okay, we've had to wait 5 years, but that 5 years in implementing laws and so on has not gone unnoticed by the rest of Europe. So the work that's gone on in Estonia, and which he's now saying, for goodness sake, move faster, much of that work, much of that invention of laws and regulations has already started to be embraced by forward-thinking countries in Europe. Not everyone, but you see, this is one of the things about Europe. It's very difficult to get all 28 member states to agree on anything, and above all, it's difficult to do anything. So our view of these things is, why don't we just get the coalition of the doers, the people who are willing to do things now, why don't we start with them? It may only be 5 countries, it may be 10. But once people see successes, and citizens say, oh, can you not do this in your own country? Your colleague at the conference was saying, look, I come from Finland, I'm in Finland, I come here with a prescription, I can't fill it. Next year you'll be able to. That demand from the consumer, the citizen, is what's going to drive what can be done right now. Your former president did a great job.
Here at the conference, the public world meets the private world. The policymakers meet the businesses. Healthcare is a big business.
It is.
So you represent, your coalition has members also from the business side. So what are their concerns? Because as I mentioned already at one of the panels, that the business world views the policymakers often rather skeptically, that they are making obstacles. They are willing to implement those new apps immediately, but. So how those two sides can collaborate?
I think, I can't think of the appropriate words to say. It's not a mutual admiration society. Whatever the opposite of that is true. So the governments look at industry as perhaps people who want to capture data, control a particular stream of data, or control people's lives.
And make fast profit.
And they say, you shouldn't make profit, and the industry say, but look, we've created all these jobs. What's the problem? And we're giving a service. The governments are looked upon by many of the industry as being too slow, risk averse, not willing to what the government perceive as take risks. So I go back to my point. Let's do what is capable of being done now. My key point is that every other sector, and we are the people, use the current devices in a way that we do not use them in the health sector. And all you've got to do is get 5 or 6 countries to say, and don't underestimate, though you may still look in Estonia and say, we have more to do, that's true, but you've done more than almost anyone in Europe, and you are now seen as a beacon, as a sign of hope that it is possible to get there sometime.
And another topic, and the point that was made here at the conference, that the European countries, the 28 members, soon 27 members, should take more commitments. There's lots of talk, lots of hot air. On the policy level, everything is rather cloudy. But let's not say that we support these ideas, we commit to these ideas. That was made, the comment made by the Austrian official.
Yes, by Clemens.
Yeah.
My response to that is this: there are instruments. We did a session yesterday, I think it was, on where's the money? Because that is obviously the oil that makes things work, and you were present. I think what came out of that was there's lots of money. The difficulty is for people at a certain level to know how to get to that money. So you look at the European Investment Bank, big bank, lots of money, objective, lend money, get out money. Their difficulty is getting the money out there. The difficulty for the people who would like the money is they don't know who to talk to in a huge bank. So you need to break it down into saying, go to Felicitas, who was on the panel, go and ask her. She wants to invest 3 billion euros in this sector. She can't do it because not enough people are asking her. So you've got that crazy situation of not matching the needs with the solutions. So that's one of the jobs that we do in the ECH Alliance. We try to literally connect people because that's what makes it happen.
We approved here today, the participants approved the European Digital Health Society Convention Declaration.
Yes.
That's a rather big document and a great document. What should be next for this declaration?
Well, as we set out this morning, I agree with you, by the way. There's declarations everywhere, and good intentions are worthwhile. But you have to move them from good intentions to practical success stories. So already the 4 task forces, which I'd remind you have only had 4 months to do their work, 3.5 actually, what they have done is set out very clearly some very practical, specific steps to actually change things. And in some cases, like the Republic of Ireland, as was demonstrated, they've already started to use the initial findings to change the way they are implementing their e-health strategy in Ireland, to empower the citizen, to create the demand. And then everybody in government goes, oh my God, the citizens really are demanding this, so I better do something. So there's a virtual circle. It accelerates because of the demand. You facilitate it by making some financial commitments, sometimes not huge, but enough to oil the wheels and get it started. So I think there's a build-up of real, genuine, otherwise we wouldn't be involved. We're about action, we're not about blah, blah, blah.
Thank you. Thank you for coming to Tallinn, and I hope that the Estonian presidency really makes some difference.
It has already made a big difference. Thank you.
Thank you. Have a good conference.
Thank you.
And we are continuing our conversations here at the Tallinn's Creative Hub. And my next guest is Hal Wolf. You represent an organization called HIMSS. What is your organization, a group?
Well, HIMSS is a global nonprofit organization which has its roots in health information management, and the Systems Society is the full name. And we work globally to help with the improvement of care and health through information and technology. So that means we convene and work in events like this. We work at government relations, we work with both systems, hospitals, provider communities, and to find way to bring technology forward and the information it creates in order to improve the development of care.
Would you can take more global view? We've been talking mostly about European kind of efforts and attempts to move to the e-health society, but globally, how is the world doing overall?
Yeah, it's an interesting time and a great question. We live in an extremely fast-paced and innovative moment in healthcare. Globally, we all have roughly the same challenges. We have an aging population, the silver tsunami, which is coming on top of us. We have people living longer than they ever have before and dealing with chronic diseases that are a part of that. We have challenging funding models. Our funding models today are holding water, if you would, but we have even more challenges coming up as we have an aging population and fewer people to contribute towards taxes versus the number of dependents that will use our healthcare systems. And we've had a lack of actionable information that providers need and consumers need and patients need in order to find the best treatment and care and the opportunities. So there are other components of those challenges, but literally everyone, and this is what's fantastic, they're all looking at the same challenges. And so when you come to a conference like we have here in Tallinn, you hear this amazing exchange of ideas and information, committees being formed to actually take actionable efforts moving forward. It's exciting.
What happens in this field in America? I think our viewers are already recognizing your American accent, so you can tell about your home country.
Yeah, well, I think in the United States, we're also in a tremendous opportunity to take advantage of the infrastructure and the technology and the EMRs, as an example, that have been put in place through meaningful use, which was a significant investment on the part of the government. And we're looking at ways to take the rules around meaningful use, which means the expectations of how providers and hospitals will utilize the technology and the information so that it's used in the care delivery and understanding clinical decision support and understanding how often we need to be in front of patients and how information technology can be used to support care delivery. So we're looking at a different set of rules that are coming up that are going to support the delivery of care on a more unified basis across the United States.
But many issues, of course, have to be solved. When in Estonia we talk about the ID card, that is one of the basics. In America, I lived 25 years in the States, so
yes.
I know the system quite well.
Yes.
In America, I think it will never happen that there will be a national ID card. We have the social security numbers there, but so what are the building blocks of the e-health society in the States?
Yeah, well, so you've had the experience in the American system, and I'll actually push back and say we probably don't have a system, especially in comparison to other countries globally. And I think that's something that we've been trying to work towards. But if you get back to what the foundations in the American system do work in the health environment, as you know, we're very consumer driven.
Absolutely.
So you see the health model, which is the applications and the expectations of the consumer and the investment in that, it is quite large. And so what's critical for us, and we're doing at HIMSS, is we support the interoperability through ensuring that there's standardization about how these applications can speak to each other. We work with the government to ensure interoperability with vendors and organizations across the country, because we know that the acceleration on the health model is critical to match it to the medical model, what's happening at the hospital, what's happening inside the clinic. These two worlds are colliding, and or joining together. You can make it a collision, which is a rough force hitting each other, or you can make it more of a smooth transition. And we're working in the States to try and make it a smooth transition.
I think many Americans know that America has probably one of the best healthcare systems in the world. The tops of American system, the hospitals, the research universities, they are just the best in the world. But for many people, this excellent healthcare is not still accessible. Many people have kind of idea that healthcare, quality healthcare is very expensive. There are government initiatives, as you know, there are Obama era initiatives, the Trump era initiatives. There are lots of kind of gray zone in American healthcare. So
No, you're absolutely right.
How do you try to clarify that for people and bring them into this
Yeah.
more clearer new age with e-health?
Well, you hit the nail on the head. It's about access, which is true, but it's about affordable access.
Yes.
And I think the tightrope that we're trying to walk, but what is clear to differentiate, is there's a difference between having insurance coverage, but what that insurance coverage pays for in terms of the access to care. And that's a debate that is being highlighted right now and challenged across the front page of our newspapers.
Yes.
And I think, quite frankly, it'll be a discussion that'll be going on for the next couple of years and will be the high point of some elections coming up. But
So, yeah.
No, please.
So when the European Commissioner on Healthcare was asked how the United States and Europe are cooperating on the e-health field, he didn't really answer us.
Yeah.
Is there a cooperation?
There is. There's a the cooperation going on in a number of areas. So first of all, for several years, there has been a joint commission between the United States and the EU, as an example, on interoperability standards. It's very important for us to be able to exchange data in de-identified, aggregated ways just on research. Secondly, because of device manufacturing application capabilities, whether at an industry level or on a personal level, again, interoperability helps commerce, and it also helps the patients and the consumers and the citizens. And by the way, each of us wear all three hats simultaneously. We'll walk in with something wrong. We'll have, as a citizen, an expectation of what our governments are doing to support us. And then as a consumer, we wanted everything yesterday and wondering why we had to walk in the door in the first place. But we're working on a joint basis and having those conversations. And then we sponsor large conferences globally. Our largest one takes place in the United States, but it truly is a global conference, which is HIMSS 18, which this year will actually be in Las Vegas. About 45,000 people will come, many from across the globe, to sit with each other, talk about these issues, and talk about how we can support each other from different points of view. There's many things the American healthcare system can learn from their European counterparts, and there are some things, hopefully, that Europeans can learn from what the Americans have gone through as well.
Absolutely. And we thank you for coming to Tallinn and bringing your knowledge and expertise to our conference here.
Absolutely. It's been an honor to be here.
And now we go with our conversations to Spain. Jordi Serrano Pons, you represent a company called Universal Doctor. That's internet-based medical
translation,
yes,
between other things.
Right. So what exactly you provide and how you help people to solve their medical problems?
Yeah, we started 10 years ago, even before iPhone was in the market. No, so we started with flash technology, with CDs. We had a problem of communication with immigrants, and we launched Universal Doctor Speaker like 10 years ago. Mm-hmm. We've been able to survive all the wave technologies, We started with iPhone application, Android. We have a web version. We are in more than 150 hospitals around the world. And basically what we do is improve communication between patients and doctors that don't share the same language. With that baseline, we have also been working in many other projects, based evidence mobile health apps that always have an impact in public health. So we are a specialized company. We started with the translation, that we have been working with many international organizations like WHO, World Health Organization, London School of Tropical Medicine. So we are doctors, myself I'm a medical doctor, no? And we want to work only in the things where we know we can have an impact. And we want to develop apps or projects, or it doesn't matter technology. We don't care about the app itself. Now it's an app, that can be a blockchain, that can be a chatbot, but we want to have a real impact with digital health.
So let's see, there is a, for example, immigrant or refugee from Syria in Spain who wants to get some medical attention. He doesn't speak Spanish. So how is your system used in that? So just describe the process.
Absolutely. We have a glossary of more than 5,000 sentences, well comprehensive and robust glossary that we've been working for 10 years. Because the problem is that we cannot have any error. An automatic translation and still voice recognition still fails. We're working with partners to incorporate that when it never fails. But in the medical field, you cannot fail. Right, so we have the medical sentences in a consecutive way. So you see, do you have fever in English or in Estonian? When you click, the audio is launched in Arabic from Syria.
So first of all, you have to log on to somewhere, right?
Yeah, somewhere. Then you are a doctor or a nurse, and you have your list of anamnesis. And then you say, I want to ask about the pulmonary function. We have dozens of sentences related to that. And you have the question, and you click, and the audio is launched in the language of the patient. Obviously, it has some limitations with a yes, no answers, some open answers, but at least for the treatment, or just to explain people, hey, you will have this kind of exploration, this kind of treatment, or we have called a professional interpreter. No? It's really very robust because we cannot fail. And we've been even collaborating with many big companies. Well, we inject our glossary in Google to compare our glossary with the automatic translation of Google, some different years. And of course, Google is improving, and we are happy. Because our business is to put one sentence after another in the conversation. If we don't have to spend money in the translation, better. But meanwhile, that really never fails. We have this compensating package.
How actively is your service used, and how much it costs?
Well, it's been used for the moment for more than 150 hospitals around the world. We have a freemium system. You can download the app, Universal Doctor, in the Apple Store, in the Android Store, in the Google Play, and for free. As a traveler, as a medicine traveling medicine app, it's working very well. You go to China, you go to Japan, and you say, oh, if I have a problem, I want to explain my symptoms in the language of the doctor. But this is the free version. But then, of course, we live from, we have to earn our money. No? We have this freemium version where hospitals have the web version with thousands of sentences, with other products. No? And it depends on each hospital. And also we differentiate. Hospitals in the OCDE region, rich countries, they have to pay an annual fee, which it depends on a hospital of 300 beds or a small hospital. Very little, thousands of euros, very little for a hospital, it's nothing. But if you are an hospital from Morocco, you can have it for free. I mean, we have that model or from Senegal to, we have that model where OCDE countries have to pay for the license, but developing countries can have it for free. I mean, it works quite well. It gives us a lot of feedback, because we're a very social company also, and we believe in that dual model.
So how to find your page again and your company on the web?
Universaldoctor.com.
Universaldoctor.com. So everybody can go and look up.
And we are also, well, this is the baseline of projects. We've been able to implement our project in 150 different places. And in these places, we've been lucky to collaborate with new projects that have to do with public health issues, with mobile health.
Here at the conference, many companies can kind of introduce their services here to the professionals. But talking about Spain in general, we know very little about e-health in Spain, here in Estonia, where we have many applications already in that field. So how far has Spain moved on this new road?
Well, Spain has, of course, 17 different healthcare systems. As a super decentralized country, so each autonomy has a different healthcare system, and even inside each autonomy, each hospital have different electronic medical records, and there is always a problem of interoperability like everywhere else. However, there's some governments, Basque governments, Catalan government, other governments of Andalusian government have developed really nice tools, no, to allow patients to connect as a medical, so to connect to the medical health record file, no, and to have access slowly to that to that content, and slowly we are in the good track. In some aspects, some of our regions are very advanced, but we have a problem of interoperability between all regions, no?
So the road is still ahead. Very long road.
But we have good experiences, and I think we can learn from each other as always.
And is there feeling in Spain that people want to have those services on internet? Are they still afraid? Is it like a whole new world for them, or they're willing to go there?
Yeah, at the end of the day, we differentiate. The problem of interoperability between European countries, it's clear, and we all know that. We are all trying to fight for that. But at the same time, we almost fail to remember that in a universal health system, like our system in Europe, where people don't pay for, not directly, for their health systems, people are not stimulated. They're not consume-driven in a way, no? Like in the States, where you have your own company, your insurance company, like Kaiser Permanente and other things.
Yes.
In that context, we need to stimulate the demand of patients, allowing them to contribute in all these, accessing the clinical files and participating in trials, studies, in surveys where they feel that they are collaborating. If we do that slowly, because we can't invent the best, most important, nice things in the world if we don't have this consumer drive approach. And it's not a consumer thing, it's a health patient thing. If patients don't use it, or if citizens for prevention aspects don't use it, then it doesn't matter.
So it all starts not from governments, it starts from citizens. When they demand it, the governments have to go and do it.
Absolutely.
And the companies have to provide it.
Yeah, it's a balance, but we always forget here the citizens. And
who are the receivers.
The receivers, no? And I believe a lot in direct democracy, and citizens have a say. And although some governments have some constitutional interrogations, no? Because they have been elected by some citizens, but they've been elected in a program. But if you would ask directly to citizens, would you like that your health records are shared to improve science, of course with security? There are clear many surveys around the world that say that almost everyone wants these things. So we have to really make the governments work with brilliant companies like here, just to try to convince not only, and to listen to citizens that want to participate. No? And a little bit, I understand that European Union is a very complicated framework, and that's good for security reasons. But at the same time, if we don't really push the accelerator in these innovations, then we will have to ask our nice partners in the rest of the Earth, and that small dot blue that you can see from Jupiter, the Earth, that okay, the most advanced solutions will be in the States, in China, which is licit. But I believe that Europe wants to be in the forefront, no? In the cutting edge space of this field. And I believe that that balance must be observed, but always listening to citizens, and not as the citizen must be in the middle, what the citizen wants. No, implicate them, and really once you have a tool, you must use it for many other policies, no? And slowly it will improve the usage. And once do you have any field where you have started using something and then it has gone back in health, in digital? I don't know any place, no? There's an example to finish. Nurses, in some places, they have to scan the medication with the personal health record for security reasons. At the beginning, in many hospitals, these implementation projects are very difficult to implement because people are not used. Once, 1 year or 2 years later, after implementation, when the system doesn't work, nurses stop to work. So we cannot work because if it fails something, so the adaptation always requires a time. But once it works, people feel more secure. I think it's what we have to do. No?
So we hope this conference kind of advances this agenda in Europe, and thank you very much for your insight.
You're welcome. Thank you. Pleasure. Thank you.
So, what are the main obstacles in Europe at the moment to get this digital health system and care really in operation?
Two major hurdles that we're facing. One is related to the trust and security of our citizens. If we use their health data, if we have the electronic health record shared, how to ensure that there is no breach to their privacy, that the data integrity is guaranteed. All these are very important hurdles that we need to address, that I call trust and security a major thing. The second thing is that we need to address is the interoperability between electronic health records. If we want to have these records accessible by all citizens all across Europe, we have to have electronic health records that are interoperable all across Europe. The two main hurdles that we need to address. The first one, we have mid-September, not too long ago, issued a whole package on cybersecurity to reinforce the capacity of the Union to protect its citizens, to protect its businesses from cyber attacks. And that includes a complete new cybersecurity scheme to be addressed at European level, a proposal for a cybersecurity certification scheme. It includes also measures to react to cyber attacks altogether, reinforcement of our operational capacity, and a proposal to reinforce our technology industrial capacity in cybersecurity. I hope with this we'll be able to protect our citizen businesses in terms of cyber breaches. That is one way to reassure our citizens that their health data and the data that they share or that is coming from the health professionals is not breached or attacked. The other point that is important is the flow of data, interoperability, as I mentioned. And there as well, we've been acting on this front. We have issued also mid-September a package on data with a regulation that ensures the free flow of data across Europe so that there is no restriction on data localization. It's a first step. We'll be coming in spring next year with a proposal also on the revision of the public sector information. It will be very important for health professionals and for the health sector. How to share the data, what are the rules for the exploitation of the data, something we're also working on. And in the area of health and health data, we have legislation that exists on cross-border rights of patients, and we're trying to see whether this legislation is sufficient to ensure cross-border access to electronic health records so that all our citizens can have access to this information. If not, we were ready to act to do more. This is something we're currently exploring, and we have announced in the midterm review of the digital single market, because all these issues are digital single market issues. We have announced in the midterm review in May this year that we will come by the end of the year, the Commission will come with a proposal to address three main issues regarding the health data and digital health and care. One is cross-border access to healthcare, or what is needed to make sure that this is ensured, cross-border access to health data. The second part is about making use of aggregated and anonymized health data for personalized medicine, for research. And the third is about getting more fluid interaction between the citizens, the patients, and the health professionals by providing more feedback and empowering the citizens to interact with the health system in general. This will come by the end of the year.
this medical data and people's privacy is in the very heart of this system.
Indeed.
Where does this skepticism come from?
It is normal that when you have that our citizens are concerned about the privacy of their health records. It's a normal thing. Who would not be? And given the number of cyber attacks that health systems around the world, or general, all systems, including health systems, all digital systems, including health systems, are today facing, it's normal that our citizens take this very seriously today. And that's why we need to reinforce all the means to prevent cyber breaches, cyber attacks, to react to them and protect our citizens and businesses. It's normal, it's something that we need to act to if we want digital transformation of care and health to be generalized and to be accepted by our citizens.
It's quite funny that we Europeans, we really appreciate this free mobility. But at the same time, if you move to another country, your data, your maybe life-saving data doesn't come with you.
Totally right. Totally right. But we have to remind that we have put in place in the Union one of the most advanced data protection regulation, which is our GDPR, that should reassure our citizens that they are in control of this data. That's very important. And that's a major step forward. The GDPR gives us that possibility, or give the citizen the possibility to control their data. It's one thing that is important and applicable all across the Union. It's a first step to make sure that rules do not change when you cross borders. Now the next step is making sure that every citizen has access to electronic health record, and that access is also available across borders. There are major discrepancies between the member states. Here in Estonia, I know that every citizen has electronic health record, that health data is shared and it's fluid. Citizens have control of this data. We don't have this in all member states. So we need to bring everyone to the same level of availability of electronic health records, and then also make sure that these are available cross-border, across Europe.
Kali Ruhana, thank you so much.
You're welcome.